Um, Thank you for that notice, Zoom. It's going to have some very real world implications. And that's our goal for this series, to create a space to not only just share words and questions and thoughts, but to leave folks with practices or strategies to put things into practice. My name is Jawan Burton. I'm with the Council of State Governments Justice Center. I'm joined by a lot of my team and operations teammates today that's making this all possible. And of course, we have a great presenter. But today is going to be like a great dinner party. I won't be able to take credit for everything. We have you all as esteemed guests, and we hope to create a great atmosphere. But I won't take credit for the meal, as the ideas and opinions that are going to come out today are going to be credit to our esteemed presenter. Um, we're providing this content for um, informative and educational usage today. The thoughts and ideas and puns and jokes that you hear today are not reflective of the Council of State Governments Justice Center and our members. Excuse me as I clear my throat there. And I do want to make sure that folks are familiar with who we are at the Council of State Governments Justice Center. If you haven't heard um, a lot about us already in preparation for today's event, the Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with policy and research expertise to develop strategies that increase public safeties and strengthen communities. The Council of State Governments Justice Center, the Council of State Governments Justice Center is committed to advancing racial equity internally and through our work with states, local governments, and tribal nations. We work by bringing people together through nonpartisanship engagement. We drive the criminal justice field forward with original research. We build momentum for policy change and provide expert assistance to our partners and stakeholders throughout the nation. And some of you who are joining us today can attest to some of that. The Council of State Governments Justice Center is dedicated to advancing racial equity in both our internal and our external collaborations with states, local communities, and tribal nations. We take on challenges to promote equity in the criminal justice system through providing rigorous research and data analysis to decision makers, helping stakeholders addressing challenging issues that are revealed by data, engaging stakeholders and employing various strategies to promote equity, and offering guidance and technical assistance to improve outcomes across justice, behavioral health, crisis response, and reentry systems. As I said, that's a critical component of how we work to bring people together to drive the criminal justice system forward in reaching our goals, to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. Before we get started on introducing our presenter and content, I'd like to speak about the overall portfolio that this is represented under, which is the Advancing Data and Corrections Virtual Academy. And what the Virtual Academy does is provides a space for corrections professionals who are looking to learn and further immerse themselves in data-driven data literacy and analytic capabilities of their Department of Corrections throughout the country. Like I said before, we hope that folks leave and engage with the Virtual Academy through data-informed planning and decision-making, and lead with practices and strategies to be implemented locally. One of the key components of the Virtual Academy and how that works is that we offer technical assistance at no cost. We hope that DOC researchers and analysts and corrections professionals can access the program's self-paced learning materials and resources, core competencies, and utilizing and leveraging peer-to-peer networks and communities of practice, once again, to implement things at a local level. And today's pilot event is kicking off our virtual seminar series, where we hope to do four things, and that's connect, build, enhance, and equip. We hope that this space allows corrections professionals to connect from various levels of experience, which we hope then contributes to building a learning community where we're sharing successful stories and other experiences that we hope to enhance the capacity for data analysis across the country. We hope that folks leave this space once again equipped with tools to implement data-driven strategies in their local agencies. And the most important part that I get to do today is to introduce you all to our esteemed presenter, Dr. Reena Chakraborty. Dr. Chakraborty is the Chief of Strategic Planning and Analysis for the DC Department of Corrections. Dr. Chakraborty brings a wealth of experience and knowledge to this venue today. She's been a jail practitioner for over 2 decades. She has a PhD in chemical engineering and a background in data, once again, spanning over 20 years in data management and forecasting. Dr. Chakraborty brings a unique analytical perspective to corrections. She's led groundbreaking work with the National Institute of Justice, where she's authored influential publications on jail research, including an analysis on COVID-19 responses in correctional facilities. Dr. Chakraborty has worked with several organizations. She's a certified advanced professional forecaster, and she has served as a program advisor for women in leadership at Florida International University. Dr. Chakraborty was recognized with the prestigious Calvin Kafritz Award for Individual Achievement, which recognizes and rewards outstanding performance and exemplary service by DC government employees. Today, Dr. Chakraborty will share her insights from her extensive experience in operations and analytics and strategic planning, specifically around her team's overtime analysis with the DC Department of Corrections. So I'm going to prepare now to hand this over and hand the controls over to Dr. Reena Chakraborty. And I hope that we all have a great time enjoying this content. So we'll pass control of everything over now to Dr. Chakraborty. Go right ahead. Thank you.
Give me a second here. Good afternoon, everyone, and thank you, Joanne, for that wonderful introduction. Before we get started into the heart of the presentation about overtime, I'd like to tell you a little bit about our agency, the DC Department of Corrections, and a little bit about my department. The DC Department of Corrections is a large jail system, and we don't operate a prison. People who are convicted of felonies in our jurisdiction, who have more than 18 months remaining to serve at the time of sentence, are removed by the U.S. Marshals and serve time at federal facilities. My department is a really small department. We have 3 operations research analysts and 2 program analysts and me. And together we are a part of the administration division. We report up through the deputy director, and the administration division is one of 7 divisions of the DC Department of Corrections. We provide strategic planning, analysis, and evaluation for our agency and support its mission with excellent customer service. If there's information or analysis involved, we support it. So here's really the 4 boxes of things that we do. We provide strategic planning, we provide data and evaluation, we provide research support, and we perform other duties as assigned. So we are, again, at our heart, a customer service organization. Hello. Sorry about that. And we wear many hats. So let's jump into the heart of the overtime analysis. What is overtime? When safety and security needs arise for which staff have not been assigned or are just simply not available, facility administrators have to think about assigning overtime. Overtime involves costs that are over and above regular salary, and overtime is governed either by the Fair Labor Standards Act or a collective bargaining agreement, also called CBA, if the labor force is unionized. Overtime may be assigned on a voluntary basis, or it may be mandatory, sometimes called drafted. It may be paid at the rate of 1.5 times the hourly rate, which is most common, but sometimes it may be paid at the hourly rate based on specific rules that apply under specific conditions. And these may be specified by the CBA or by law. So, financially speaking, when you look at overtime, maintaining full-time positions results in costs due to salary and benefits, as well as shift differentials and sometimes hazard pay. So these costs are typically about 40% of the salary, whereas overtime typically costs 1.5 times the hourly salary rate, and some of it may actually be at the salary rate. So financially, it looks like it might be a wash. So you might be asking yourself, why such a fuss? Well, there are operational impacts of overtime. If an agency is operating consistently short-staffed, utilizing large amounts of overtime in operations, that can result in staff fatigue. And staff fatigue may have negative impacts on safety and security. Here are some of the negative impacts that may occur. It may be difficult for staff to maintain alertness, and they may experience challenges to being emotionally present, and that results in wellness risks for all. Staff may be tempted to take shortcuts or too tired to complete all duties as assigned, and that can result in compliance risks. Finally, performance and productivity may decline, and elevated operational risks may occur, and that can result in risk of costly errors. But these aren't the only risks and impacts. When overtime utilization is high, agencies have to hold positions vacant to remain within budget. They simply can't hire. And complying with annual training requirements becomes very difficult. So the bottom line is that overtime management is critical for every correctional agency, whether we're a jail or a prison. So where does analysis come in? Well, overtime analysis can help facility administrators manage overtime. It can affirm overtime allocations and utilization patterns. It can also provide actionable insight. For example, it could lead to questions and insights about where and when overtime is being assigned and why. And it may also lead to insights about, for example, who's calling out if it's leave-related overtime and why. So we can use overtime data to create metrics that can explain overtime use in the terms of the net FTE impact. And I'll get into that a little later in this talk. Well, before we start analysis, I think it's always good to have a process. And our process starts with questions. So once we know the questions we want to answer, that suggests the data that we need. And the data structure and quality suggests methods and tools. The nature of the results we get from the analysis then suggests how to visualize the results. And then when we share those results and visualizations with subject matter experts, that generates feedback. And it also generates more questions and allows this cycle of analysis to continue. So at the heart of analysis is questions, right? What questions are driving the analysis? Well, in terms of overtime analysis, these questions are divided into primarily two categories. The first has to do with process and practice, and the second with impact. Regarding process and practice, some of the questions we ask are, how much overtime is being used by facility or unit? When is it assigned? So we look at overtime by shift and overtime assignment lengths. How is it assigned? Is it mandatory or voluntary? Why is it assigned? What activities are contributing to the overtime? And where is it assigned? Which posts are using the most overtime? In terms of the impact, we look at financial impact, for example. What does overtime cost? Who are the highest overtime earners? And by the way, in our jurisdiction, we have to report the top 25 overtime earners to our legislative body every year. If all the overtime hours were full-time equivalents, correctional officers, how many correctional officers would that be? So these are the questions we're going to look at. Before I walk into actually showing you the analysis, I thought it might be helpful to go through this little flow chart. So first we're going to talk about the overtime data structure, and then what happens when we add the payroll data to that structure so that we can compute the financial metrics. Then we'll talk about the methods we select to do the analysis and why. We'll talk a little bit about the importance of checking our results against business processes and sharing with the results with subject matter experts to find out whether we have missing elements. And if we have missing elements, why it becomes really important to know the practice. And all of that then leads to the next level questions, which then we go back and we try to answer. And that continues the process of analysis. So let's talk a little bit about data structure. In terms of the overtime data, what we find is we have many, many rows of data, but not that many variables. So if you look at this overtime data, what we find is there is the time that the overtime started, the time that the overtime ended, the difference between those two times in hours, the employee names, obviously fake here, um, employee IDs, which are not shown, the activity that led to overtime, the reason that the overtime was assigned, the facility that made the overtime assignment, and the specific post to which the overtime was assigned. Now, you may notice that there are some blanks here, and there, I assure you there is data in there, but I blanked them out because I wanted to de-identify the data. What we'll talk about is that some computations and variable transformations are required in order to perform the analysis, and that includes a certain amount of manual coding of text variables. So let's talk about the final data structure. Oops. All right. So in addition to the start time and end time, what we find we're really interested in is the hour that the overtime assignment started and the hour that the overtime assignment ended, because that allows us to figure out what shift the overtime was assigned on. Because our financial data actually lags the operations data by 2 to 4 weeks, like 1 to 2 pay periods, we have to share this overtime analysis with our agency fiscal officer staff. And they track their data by pay period. So we also figure out what pay period we are in within the fiscal year for this analysis. In addition, we have to report out as a part of our agency performance accountability reporting. So it's important to know the overtime by month. So we also compute what month the overtime occurred in. I'll get into the financial data in just a minute. And the last two variables that you see in columns Q and R are the post category, which is where the overtime was assigned, not in terms of specific posts, but in terms of where in the facility the overtime was assigned and whether or not that overtime was mandatory or drafted. So the payroll data comes to us in CSV files, which we then convert to Excel files. And the overtime data also comes to us in CSV files, which we convert to Excel files. So all of our data is in Excel. And that allows us to use Excel naturally as the tool in which we are going to do the analysis. So what we do is we match the position funding report data by employee ID to pull in the hourly rates. You'll see that there are actually two columns here that provide one in column J that provides an estimated cost, and one in column K which provides the actual cost. So it used to be that we did not get payroll data very often. And when we had new hires, there wasn't a way to estimate what the cost was. So we used a global average rate, hourly rate of overtime in order to do that cost estimation. Nowadays, we get payroll data on a weekly basis, so we're able to actually compute the actual overtime costs for every employee. So we use the function VLOOKUP to do this matching, and it's really rapid. And this allows us to compute the paid hours. So you might ask, well, you're already getting the hours. Why do you need paid hours? Well, in our jurisdiction, if the overtime assignment is over 4 hours, then people get 30 minutes of unpaid lunch. And our fiscal officer is interested in how much are we forking out for overtime, right? In the end, how much did it cost us? So that is why we compute the paid hours. Um, in terms of the the variables that we have to code manually, the text variables, I alluded to the post category names. And in our system, we have 167 post categories for the 3 facilities and 2 units that use overtime. And initially, yes, we had to go through and code each of those manually. Now, once they're done in subsequent pay periods, it's simply a copy and paste or a fill down type of operation. So it takes maybe a couple of hours to do all 167 categories manually. It's a lot of work, but the end result is certainly worth it to our facility administrators, and that's why we do it. The second variable that has to be manually coded is whether or not the overtime was voluntary or mandatory. And some of that information comes from column N, but in other cases, that information comes from a notes field, which I haven't shown, and we have to pull that in by doing text filtering and pulling the data that way. So, as I mentioned, all the data is in Excel, and so pivot tables are a great way to do the analysis. And if you'll give me a minute, I'm now going to shift and show you what some of those pivot tables that we use look like. So the first pivot table that I'm showing you shows how we break out the overtime by pay period and facilities. As I mentioned, we have 3 facilities, facility 1, facility 2, and facility 3, and 2 units that use overtime. So if you were the agency fiscal officer and you wanted to say, well, which facility is using the most overtime? Clearly you can see from here, it's facility number 3, right? This pivot tables also allow us to dig in. So our facility administrators would want to know things like, well, which shift is using the most overtime? So for every facility, we can now look at which shift, in this case, shift number 2, which is our day shift, it's using about half of the overtime. And that makes sense for the way we operate. And then finally, we can dig into how much of that overtime is voluntary or mandatory. And facility administrators in facility number 2 always say that we have an exceptionally high level of mandatory overtime because of the way we're staffed. And in fact, the data bears that out. So you can see that, you know, three out of 12, right? So what I can't for the life of me compute right now, but they have a rather high rate of drafted overtime. One of the questions I talked about was the length of the overtime assignment. And this becomes important because people ask, well, do we really need to have everybody stay pretty much the length of the whole shift? Um, and when we look at that, we say, well, most people actually work the entire shift in terms of overtime. And so I'm showing this for facility number 2, where they had the issue with where they're having issues with a high level of drafted overtime. And one of our facility administrators took a look at this data and said, hey, here's an opportunity for me to figure out how we can let some of those people who are on mandatory overtime leave earlier on in the shift so that they can have better work-life balance. So this is an example of the way some of this information might be used. So I also wanted to show you overtime earners and how we track this. Pivot tables are a really great way to track who the top 25 are so that we can see what that's looking like. It's as much as we don't like to release identifiable information, and we want to make sure that what we release is justifiable. So this helps us do that. And then we can also look at overtime by post category, which becomes really important. So over here in column A, in highlighted in pink, you see the 10% of posts that actually use up 50% of the overtime. So you might ask, well, what are these posts? What is MHU? Well, MHU stands for Medical Holding Unit, and it has nothing to do with holding people medically. What it is the name that we use for the unit that provides transportation to clinics and to provides a medical outpost security. So when people are in hospital as inpatients, or somebody has to be transported to the hospital for confirmatory testing, right? These are the people that do that work, and that operation runs heavily on overtime. Um, then the next category you see is added security. So you might ask, well, what is added security? Added security is what occurs when we have to assign overtime to a location, but there's not a post at that location. So it's true that if we read the notes field and extracted the information from the notes field, we can find out where that security was added. Now, I'm not showing that, but that is in fact what we do. It's even more text coding. Um, Lately, we have worked with the facility administrators to eliminate that field. Um, so all other supervisors, we, like every other agency right now, have a shortage of supervisors. So that those functions are run on overtime. Detailed officers. This is when what happens when somebody it has a post and they're assigned to it, but we need them to work somewhere else on a long-term basis. So the post that they were originally assigned to has to be backfilled using overtime. Movement control. What is that? Well, in our facilities, a lot of the movement is escorted, and we need officers to do that, and that takes a lot of overtime. Culinary operations, well, we feed 2,000 people 3 times a day, and that takes a lot of staff in order to accomplish. Um, so that's another operation that runs heavily on overtime. IRC is the Inmate Reception Center. That is our intake and release operations, um, and our inmate clothing distribution operation. And that is a huge utilizer of overtime. Cell block B9, it is a cell block in one of the facilities. Um, the TRU and escort, that's our tactical response unit and the escort functions that are associated with that work. That also runs on overtime. Then we have a couple more cell blocks and then the command center. So when we share this information at this level of detail with our facility staff, they have the aha moments. So most of the time, what it is they affirm, oh yeah, that's what we're seeing on the ground. Sometimes they may ask questions as to, okay, you're looking at this. Is this isolated to one shift, or is it isolated to a particular facility? And we have the data, and we're quickly able to show them that in our monthly meetings that we have with them, where we discuss this data that I'm showing you. Um, and then finally, I want to talk about overtime by activity. So we have a lot of different categories of activity, but basically they roll up into about 11 categories. And the activity that leads to the highest amount of overtime is due to leave utilization of all kinds. And I'll give you an example of what an further analysis that sparked in just a little bit. But between leave utilization, open posts, this is where we've got master roster posts, but nobody signed up for them, so we have to operate them on overtime. Medical clinics and outposts, which I explained a little earlier. Facility needs that arise that weren't planned for. And then supervisory tasks. These make up about 75% of the overtime that is assigned. So at this point, I'm going to switch back to the slides. And one of the things that I spoke about was how we can use pivot table results for visualization, and how we can explain some of the data in a way that's more readily understandable for people. So this graph that you're looking at on the y-axis, you see the annual hours of overtime that were assigned. And you can see between fiscal years 2015 and 2018, the overtime utilization increased at pretty much a linear rate. The numbers that you're seeing in bold black, those are if you converted all the hours of overtime that were used in a year to how many correctional officers that would be by dividing that number by 2080, which is the annual hours a single correctional officer would work, then that's the number of FTE that we would have, the number of correctional officers. And what we find is that that number is related to staff shortages and vacancies. So looking at a number like 500,000 just blows people's mind. But when you can um, translate it in these terms, and we say, okay, in 2018 we had a staffing analysis. That staffing analysis found that we were short staffed. In 2019, we were authorized 80 positions, and we filled those 80 positions, and look what happened. Our overtime came down by 80 FTEs. So it helps us have a discussion with decision makers. It helps our decision makers, our leadership, have discussions with decision makers in our jurisdiction to explain overtime utilization in a way that is a little bit more readily accessible than simply discussing overtime hours. So that's what we try to do as analysts. So as analysts, we're called upon to try and make sense of the data. That's a large part of what we do. So we ask questions like, does the information make sense in light of the known business processes? Do the subject matter experts affirm that the outputs of an analysis make sense? If not, what doesn't make sense? We want to know that so we can dig into it. And then we want to know what further questions they have. And then we go and we look at the data available to see whether it's possible to answer their questions. Now I'd like to give you an example where understanding the practice really matters. So the example I'd like to give you relates back to the leave utilization. So this tree map here, and it's asynchronous, it belongs to a different fiscal year, shows all the proportion of all the different types of leave that led to overtime. And you can see that the largest category is because people called out sick. So the question was, okay, who is calling out sick? And more specifically, which posts are they calling out sick from that are resulting in overtime? Because we know all these people are not really that sick. So the question is, which posts were they assigned to when they called out sick? So can we design some sort of management strategy to help reduce the calling out of the the sick, the people who call out sick? Thank you. Okay. So as good analysts, what we did was we said, all right, let us look at the master roster because the master roster tells us, where people are assigned. So we can tell what posts they were assigned to when they were called out sick. So when we did that, we see this graph on the left, and you see that people who were assigned as relief officers most frequently called out sick. That's followed by people who were assigned to cell block B2, cell block A1, the medical outposts and transports, and then you've got everybody else, right? So when we shared this within our team, we were fortunate enough to have somebody who actually knew the practice. And that person said, hey, no, that's not the way it works. The way it works is on the day that you're going to go to work, 2 hours before, you look up in the roster system where it is that you're assigned. So what's important is where people were assigned on the day they called out. I said, oh, well, let us redo the analysis that way. When we redid the analysis that way, it looked very different. What we could see is, yes, people who were assigned as relief officers were indeed the ones who called out sick most frequently, but far more frequently than what our previous analysis, based on incorrect assumptions and understanding of the practice, showed. Also, what we found is people who were assigned to added security positions where there's not really a post, but we need them to provide security, they also called out very frequently. And then everything else kind of paled in comparison. The number two cell block, right? The cell block B2, which showed up in the number two position, actually doesn't show up until position number 5 here. So, and um, the frequency with which people called out is much lower than the previous analysis, which was based on an incorrect understanding of practice showed. So, when we share the good data based upon actual understanding of practice with facility administrators, guess what? We equip them to make good decisions and to form effective strategies for addressing these issues. And that's what we try to do. So, to put it all together, the questions that people ask are very important because they guide analysis. And the methods that we select depend upon data availability, quality, and structure, not to mention format. Preparing the data takes a significant effort, and manual data extraction or coding may be required, which is tedious and time consuming and painful, let's just face it. But it really makes a difference, and that's why we do this work. Pivot tables are a great tool when the data is in Excel. Sense making, which is what we're required to do, requires an understanding of the policy, the process, and the practice, as well as the technical aspects of analysis. Honest feedback from subject matter experts is invaluable, and that's why maintaining good customer relationships is a must. It's as much a part of all the work that we do as analysts as anything else. It's really critical. And then we're always seeking simple ways to relate analysis to convey its impact. And that is what we do as analysts when we analyze overtime data. So thank you so much. And at this point, I'd like to open it up for any questions you might have. And I will stop sharing my screen and turn it back over to you guys.
Thank you. Thank you very much, Dr. Chakraborty. And I saw that Greg mentioned there was a little error with our Q&A application here in the Zoom app today. So we definitely want to make sure that folks have a chance to ask questions in the chat. We'll try to get to a couple of those. I see now a question that I saw someone already responded to. There was a request about getting access to the presentation and copies of the slides. We'll definitely figure out a way for those to be shared by Dr. Chakraborty in the safest way possible, and also giving folks an access to a recording of the webinar will be available on the CSG Justice Center website, and our operations team will make sure that that's completed within 1 or 2 weeks, according to what I'm seeing here from folks behind the scenes. So thanks a lot, Greg, for that tidbit. So if there weren't any questions, I just wanted to thank Dr. Chakraborty. Well, I just saw a question that popped up coming from one of our own, and I want to give Dr. Chakraborty the full floor to answer this question. The question, Dr. Chakraborty, if you could speak to any of the follow-up actions that DOC staff took after receiving your analysis. And I know that some of in our preparation for this, that there was some talk about how some of that response was kind of, I don't want to say classified, but there was some sensitivity around the follow-up. But Dr. Chakraborty, if you could speak to any of the follow-up actions.
So, as I mentioned, we share this data with the facility administrators and operations leadership and our fiscal officer once a month. The facility administrators then dig into the data and ask questions, and we're able to help answer their questions. And a couple of things that have happened since we started this process are number one, that we realized that the added security category wasn't being very meaningful. And so the majors worked very hard to eliminate the use of that so that we get meaningful information and they can get more meaningful assessments. Um, Another thing that happened is in terms of the length of the overtime assignments, and I talked about that briefly. So one of the facility administrators took a look at that data and started asking, is it really necessary for people to stay the whole 8 hours? And in some cases, there are excellent reasons why people need to stay the whole 8 hours. But what she found is that that's not true in all cases, and particularly where, as I said, mentioned, where people are being drafted to provide overtime services. She has made an effort to send people home once their assignments are done, and that has allowed her to reduce the amount of overtime use. So these are two examples of follow-up actions that people have taken uh, as a result of looking at this analysis. There may be other things, but they're security sensitive. So I just want to say that as analysts, our job is to help people answer questions and to make sense of the data. And also when we're asked to help people monitor the results of their action. So, right, once they take an action, we can look in the data and see if there was any changes to the data. And we do that, um, because that's what we're supposed to do. And it helps, and we're told that it's helpful. But we are not empowered to take action. So we respect that division of labor. I hope that helps.
Thank you. Thank you. I have two questions. I'm going to get to one in a second, but I wanted to ask what I felt might be the first, the easiest one or the shortest answer rather. In terms of reducing overtime utilization, the question is how often would you recommend doing a staff analysis, and or maybe even how often you all have done that practice in DC, Dr. Chakraborty?
To be honest, the last time we had a formal staffing analysis by a third party was in 2018. These are significant undertakings in terms of the level of effort required. NIC has a methodology for conducting staffing analysis, and there's a lot that goes into it. So even though best practices might say that you should do this once a year or once every 2 years, the fact of the matter is, especially when you're short-staffed, that is not always possible. That being said, we do keep an eye on what's changing, and we may not go through the full formal staffing analysis, but we may use less rigorous and yet still effective means in terms of what in terms of informing our agency operations to do that analysis. However, I will also say this: when uniform vacancy rates are 25%, uh, doing a staffing analysis doesn't really make sense, because what makes sense is, hey, coming up with a strategy as to how we are going to reduce that vacancy rate significantly. And that's where the effort tends to be. So, when you're decently staffed, let me not say fully staffed, because corrections agencies rarely are, but when you're decently staffed, then it makes sense to do a staffing analysis. But when it's obvious that your problem is that you are grossly understaffed, then it probably makes more sense to put your efforts into trying to staff up. I hope that helps.
Thank you, Dr. Chakraborty. And I actually another function of this seminar series, want to make sure this is a great, like I said, the dinner party atmosphere. This is the part where like smoozing and walk around with those fancy plates that hold your drink and your appetizer, so you have a free hand. So we're in that part now. Um, so there's a question coming from one of our attendees. I'm gonna try to unmute you here or ask you to unmute, Petra, if you want to do that and ask your question.
Hello.
Oh, there I go.
Hi. Thank you for
Hi.
taking my.
Hi.
Oh, hi. I'm Patria from the North Dakota Department of Corrections. And my question is, when you update your Excel file, if it's monthly or every other week with the information that you're getting, um, what does that process look like? Like, how are you importing that information? Are you running queries in Excel? What does that look like?
Um, so the overtime data comes from our electronic roster management system. There is a canned crystal report that one of my team members pulls, and the output is as a CSV file. So she converts that to an Excel file and she sends it my way. And pretty much after that, I add all the columns needed so that I can just copy and paste it in and append it to the last pay period's worth of data, which I maintain. And so I have like 20 pay periods of data or 23 pay periods of data in uh, an Excel file, and I take the incoming pay periods worth of data and just copy and paste it in right underneath. Um, and then I have formulas for computing the shift and the paid hours and the month and so forth. It's just a simple fill down function, right? Where it gets to where we have to do some manual work is in the post categories. So I filter by a keyword on the post, right? And and I'm sure to filter on a couple of pay periods prior. So I'm able to pick up how those posts were coded. And then it's simply a fill down. Um, but that process has to be repeated 170 times, right? So a little clunky, but that's pretty much it. Yeah.
Yeah, a little clunky but straightforward, right? And you don't have
Yes.
to do it repeatedly. So thanks. Thank
Yes.
you for the presentation too. It was great.
Thank you.
Hi, Rena.
Hi, Ashley.
So I have a question for you.
Mm.
So, with regards to this analysis, I was asking if, in the end, did this analysis help with the call out rate once these supervisors or the people creating the schedules understood what was happening as far as placing people more strategically going forward?
Well, I'm glad you brought up that question. Um, we sometimes you can look at the data and you can see what it says, and management may even act to try and address some of the issues. But some of the issues that they have to address as managers are gnarly and they've been there, long-standing, and they're difficult to address. So I suspect that if we went in there and looked again, we might see a similar pattern. Now, would the magnitude have changed? I would hope so. But would the overall pattern have changed? Probably not, because of the nature of the issues involved. And so we also have to be open to that. But and we have to remember that our role as analysts is to help people monitor and to give people honest information about what is going on so that they can do what they need to do as administrators and managers and supervisors to take the actions that they need to take. So thank you for that question. And I will also repeat again that our other role is to help make sense of the data so that our supervisors, our leadership can explain the overtime utilization in a way that higher level leadership in our jurisdiction can understand, right? And that's why being able to interpret it in terms of the FTE impact is really important because you can relate that to things like vacancy rate, and you can relate that to the amount of unplanned activity that occurs that results in overtime. For example, one of the things we know is that correctional populations generally suffer from higher levels of chronic illness and other conditions than the general population. And some of these are long-term, long-standing, serious health conditions. So in our facility, on an average day, we may have 3 medical emergencies that arise. And so, that results in the need for 6 staff to go out and supervise these inmates, whether they're maintained in the hospital for less than a day or whether they wind up being inpatient in hospital. And those operations are run on overtime because we are not staffed in a way to provide those. So, being able to explain overtime in that way, okay, this much overtime worth this many FTEs is due to unplanned activities, and this much is due to the vacancy rate. People can connect to that relatively easily, and it helps facilitate that conversation. So this is what we try to do. I hope that helped answer your question.
Thank you, Dr. Chakraborty, for answering that. I don't see any other questions coming up, so I just wanted to give a collective round of applause and appreciation and thanks for you joining us today and providing once again. I think my takeaway, Dr. Chakraborty, is that this is like a journey, right, in terms of data analysis and the journey of answering questions and providing feedback and waiting on how things are implemented and seeing the change over time. And I know that if your team was here, I know you'd shout them out because the time we met them, you really talked, they really loved the work and it was great to meet them. And I'm pretty sure they would agree that the journey involves so many people. And there was one point in time in the presentation where, I've had the benefit of seeing this over 8 times, right? But you talked about being able to make sure that the right people were in the room and at the right point in the discussion, you're bringing folks to provide the application and practice into the discussion. And I think that the overall journey just requires the right calibration or back and forth of who's involved and where they are, but to have the right people there at all times to make these decisions. And I'm really appreciative of this presentation, the data you presented, what it provides and attributes to just this community forum as well. And so the seminar series and you kicking off the pilot seminar series, which once again is also going to be a part of a journey. And that journey doesn't end today, it only starts. It gives us a chance to talk about other ways that you all can stay in touch with this portfolio under the Advancing Data and Corrections Virtual Academy. We offer quite a few opportunities for engagement. Once again, we have a community forum and where we're bringing folks together from the field to ask questions, to once again, that peer-to-peer relationship and learning that part of the journey. We understand that as part is critical. This forum is accessible to folks who can register. So we encourage you to go to our website, which we're going to make sure the links are in the chat to sign up for our community forum. There you can also get a chance to see other verticals that we have. We also have office hours. And that's where I was able to engage with Petria for the first time. Not to say that I had any favoritism to letting her come on and ask a question because I would do that to anyone, but that was my opportunity to engage with her and to hear questions from her, insights from her, and what she's doing in the great state of Montana a couple of weeks ago. So good to see you again, and hopefully we can have others join those office hours and other forums that we have. And also, in addition to furthering this seminar series, we hope to, invite others and engage others and give folks a chance to share their success stories and their learning opportunities as well. And right now, I want to make sure we give folks a chance to tell us about your experience today. So I'm going to bring on our Deputy Operations Director to give us a little bit of feedback of how we can do that. Greg, you want to take it over?
Yes. Hello, everyone. The link that is on the screen right now, the QR code, as well as the link that I'm posting in the chat right now, There's a link to our post-webinar survey. This project is funded by our federal funders, the Bureau of Justice Assistance at the Department of Justice. As a result of that, we want to make sure that this technical assistance that we're providing to everyone is improved, and we'd like to get your feedback on this event. So if you can, please complete this quick survey. It should take no less than 5 minutes of your time. It really helps us to assess the quality and impact of this training and better understand where there may be some opportunities for improvement. As Jawan mentioned, this is a virtual seminar series, so there will be many other seminars on this topic, and we want to make sure that as we are producing these and going live with them, that we're improving each and every time. So we'd love it if you can provide your feedback on the survey. Like I said, there's a QR code on the screen right now, as well as a quick link that I just posted in the chat. Thanks, Joanne.
Thanks, Greg, and thanks to everyone who took time to join us today. Special thanks again to Dr. Chakraborty and also her team, who I'm pretty sure were very vital and critical in her putting together this content that we shared today. And I'm also posting in the chat a place where folks can go to stay connected with the CSG Justice Center, our resources and newsletters and other communications that we have here. And if you have any questions about the seminar series and how you can get involved, or any other questions about advancing data and corrections, I'll say that again, advancing data and corrections. If you have any other questions, if I can't answer them, I'll be sure to pass them on to someone else. But special thanks to my team, everyone that worked behind the scenes to help us make this pilot event success today. And most importantly, thank you all for joining, and we'll see you all on the next one. So once again, it's a part of a journey, so see you along the way. Thanks, everyone.
Thank you. Thank you for having me. So honored.
Thank
Appreciate
you.
it. Bye.
Thank you.